Okay, let's get into this. We know COVID-19 was thankfully mild for many people,
Right.
but for others, it took a really serious turn, often leading to one specific dangerous complication.
And that's COVID pneumonia. We've spent time going through, research, clinical notes, even patient stories for this deep dive.
Yeah, pulling out the absolute essentials.
Exactly. What you, the listener, really need to grasp about this specific condition.
We want to move beyond the basics and share key insights. Some surprising ones, too, including a pretty fascinating real-life story.
It really highlights how unpredictable things could be.
So, first things first. What actually is COVID pneumonia? How's it different from, say, the pneumonia you might get with the flu?
Fundamentally, it's a lung infection caused directly by the SARS-CoV-2 virus. It's not really a separate disease, more like a serious stage or complication of COVID-19 itself.
Okay, and how does it, damage the lungs?
Well, the virus gets into those tiny air sacs, the alveoli, where
Yeah.
you exchange oxygen. Your immune system then launches this major response.
Which sounds good, but
Yep. Right. But that intense battle causes widespread inflammation. Fluid starts leaking into those air sacs. The lungs get stiff, less efficient,
making it harder to breathe.
much harder. It drastically cuts down the oxygen getting into your blood.
That sounds similar to other pneumonias in some ways.
Yeah.
What did the sources say makes COVID pneumonia stand out?
One key thing often highlighted is that it frequently affects both lungs, so it's bilateral.
Ah, okay.
And maybe more interestingly, the research suggests a different pattern of spreading through the lungs.
Different how?
Well, think of bacterial pneumonia sometimes acting like a wildfire, spreading fast in one zone. COVID pneumonia, one source used the analogy of a slow burn.
A slow burn.
Yeah.
Intriguing. What does that mean in practice?
It seems the virus might infect pockets and then kind of use our own immune cells to gradually spread the inflammation over time through the lung tissue.
Sort of creeping along.
Exactly. A slower, more diffuse process, which might explain why it can sometimes cause such extensive damage across both lungs and maybe last longer.
That definitely makes spotting the signs early even more critical. What's the number one symptom people need to be aware of?
The sources are really clear on this. The most urgent sign that a COVID infection might be shifting to pneumonia is worsening difficulty breathing, or
Yeah.
shortness of breath.
Not just feeling tired, but actually struggling for air.
Precisely. A noticeable change.
And if someone with COVID notices that, or maybe other serious signs.
They need medical help immediately. Go to the ER. Other red flags are things like sudden confusion, extreme fatigue you can't shake, chest pain or tightness,
Okay.
or seeing any bluish color on the lips, skin, or nails. That's a sign oxygen levels are dangerously low. Delaying can really impact survival.
Don't wait.
Don't wait, get checked out.
Who is most at risk for developing this severe pneumonia? We know not everyone did.
Right. While maybe around 15% of COVID cases develop serious issues, the risk is definitely higher for certain groups. Older adults, especially over 65,
Okay.
people who are pregnant, those with a history of smoking, and individuals with certain underlying health conditions.
What kind of conditions specifically?
Things like heart disease, chronic lung diseases, COPD, asthma, also diabetes, obesity, or anything that weakens the immune system. These are consistently flagged in the research. Knowing your own risk factors is important.
Let's shift to that case study you mentioned earlier, the 87-year-old woman. It really stood out in the source material.
It did. This patient already had, well, a complex health picture. Chronic heart problems, COPD, high blood pressure. Then she got severe COVID pneumonia during an outbreak at her rehab center. A very tough situation.
So she arrives at the hospital. She's critically ill, struggling to breathe. Imaging showed
What?
extensive damage.
Yeah, widespread ground glass opacities and consolidation.
Yeah.
Basically, large areas in both lungs were inflamed and filled with fluid. Not good signs.
In her blood tests.
Also pointed to a poor prognosis. Things like low lymphocyte counts, those are key immune cells, and high D-dimer levels, which can signal clotting issues often seen in severe COVID.
So her age, her health history, how sick she was, the lab results, everything pointed towards a really bad outcome.
Statistically, yes. Her hospital stay was long, 17 days, and complicated. She needed intensive care.
But she didn't follow the statistics.
Remarkably, no. Despite all those factors pointing the other way, she recovered enough to be transferred out of the ICU.
Which is amazing. Did the sources offer any ideas why? Against such odds.
They speculated a bit. One thought was maybe her prior physical activity level, perhaps from her rehab, offered some kind of protective effect, even at her age. It's just a hypothesis, though.
Interesting. Anything else?
The other factor they discussed was a specific treatment she received, high-dose heparin. It was initially for her heart, but heparin also has anti-inflammatory and anti-clotting effects.
Ah, and some studies looked at heparin for COVID.
Yes. The source didn't say heparin caused her survival, but suggested it might have contributed, playing a role against that grim forecast. It points to areas needing more research.
Fascinating how complex these individual cases can be. So turning back to treatment more generally for severe COVID pneumonia,
Hospitalization is pretty much standard for severe cases. Treatment is mainly supportive. Oxygen is key, sometimes needing a ventilator. Then specific meds.
like antivirals.
Yes, antivirals, often corticosteroids to reduce that intense inflammation. And maybe antibiotics if there's a worry about a secondary bacterial infection.
And recovery, it's not quick, is it?
Definitely not. Moderate cases might take weeks. Severe pneumonia, recovery can stretch over months. And follow-up scans can show lingering lung scarring, fibrosis. That's a potential long-term issue.
And what about those lingering symptoms we hear about? Long COVID.
That's a crucial point. Unlike recovering from flu or other typical pneumonias, COVID recovery can be marked by post-acute symptoms. Fatigue, ongoing shortness of breath, joint pain. These can persist for months, even a year or more sometimes. It really distinguishes COVID's long-term impact.
Given how serious this can be, prevention seems paramount. What are the key strategies the sources highlight?
Top of the list, COVID-19 vaccination. It significantly reduces the risk of getting severely ill and developing pneumonia.
Makes sense.
Also, getting the pneumococcal vaccine is often recommended. Basic hygiene, washing hands, avoiding close contact with sick people, and really importantly, managing any chronic health conditions you have effectively. Control the diabetes, manage the heart disease. That helps lower your risk.
So the core message seems pretty clear. Know your personal risk, be vigilant about symptoms, especially worsening breathing if you have COVID.
Absolutely. And seek medical help fast if those symptoms appear. Prompt action really matters.
It leads to a final thought, doesn't it? When you think about how this virus works, that slow burn in the lungs, and then you see these stories of unexpected resilience like that 87-year-old woman, how does that change how you think about our bodies fighting off new diseases and maybe how we face future health challenges?